काय आहे प्रोब? प्रोब काय? ओके, जो ग्लो लिया क्या? स्टेरल है? लेफ्ट अಲ್ಲ? So left lobe of thyroid nodule. Mungima? Patient able to swallow, but moves with the swallowing. This is the thyroid swelling, which is appearing approximately around 60 cc. This is the longitudinal section. Okay. Now we are going to ablate. First method, first of all, we need to give a local anesthesia, and we need FNAC actually already proven that is a benign tumor. So just one more FNAC we are taking before the procedure. Small sun injection, no? A small prick. So after that, tumescent we have to infiltrate between the thyroid capsule and the deep fascia. So this is the method. We are injecting a small prick, and in that patient will have painless procedure. Show the screen, also the screen, if you can appreciate. That's the needle. Ma aramidira, noidya? Churu irutte ashte. Ashte. You can see that between the thyroid and the skin we are infiltrating anterior to the thyroid capsule to make it painless. The bright one is the needle. You can see dynamically. So everything works under the vision, that is under the ultrasound. This thing. There is no need to cut open and do the procedure. Here we can do under ultrasound guidance, that is without cut anything, and with the patient conscious, oriented. And also we can, main thing is we can monitor what's going on, whether both pain and everything. Slides ready? Small prick. No idre ma. This is just to do FNAC. You can see the nodule. This is a FNAC. FNAC is fine needle aspiration cytology to look for the cells. Again, every time we are doing, better to do FNAC and look for the cells whether they have any changes. Okay. Aitma. You take a saline. How much saline?
50 ml of saline.
Okay. Okay. Yeah. Little hemorrhagic, but still that's fine. Okay. That is the thing. You can give local the spinal needle. So, little thing about, see, the thyroid nodule can be treated either by cut opening and removing the entire thyroid, that is total thyroidectomy, or the hemithyroid, half of the thyroid. But now, save thyroid. Save thyroid means because of one nodule, this is on the left side, why to remove the entire thyroid? So we can save the thyroid gland so that patient will not go for the complete replacement therapy later on. So that's the reason we can only ablate. Ablate means this gland only can be only this nodule only can be cured. So by this technique, how it works is we will just burn or ablation rather than burning. We can do ablation. In this technique, we can only using heat treatment destroy the cells which are abnormal or whatever the nodule wherever it is there, only in that nodule, saving rest of the nodule. So in this method there is no bleed, there is no pain, and there is no cut or scar, and patient will be conscious and daycare procedure. That's how we are doing, and completely visible under ultrasound guidance. See, to remove the thyroid, we need to open up the skin and see the thyroid. Here, there is no need for opening up. We can still see the thyroid. So I am infiltrating the fluid mixture of saline as well as lignocaine, which is local anesthesia, for the painless procedure around the thyroid capsule. So you can see that is a fluid which is displacing the skin, so that whatever heat treatment we give will not affect the skin as well as give a good anesthesia. It is a double working. That is, one thing is it acts as a shield. See, these are the carotid vessels. Give man saline. Give the solution. Prepare this. You can see here, this is the pulsating thing. These are carotid vessels. When we put a color, so close to the thyroid, we have to separate this thyroid gland from by using a tumescent injection, whatever that solution of saline as well as local anesthesia. It also protects from the heat caused during the treatment. So these are the blood vessels which we are seeing within the thyroid. All those things will be reduced. The vascularity of the thyroid is completely reduced, and this whatever gland we are seeing, the big gland, will shrink. And just for your comparison of the normal gland, I want to show. So can you appreciate this? This is a carotid vessel, and that is a normal gland. So compared to that is in the right side. So in the left side, you can see the abnormal gland with small cystic areas as well as multiple heterogeneous areas. And patient has little swallowing difficulty as well as the swelling in the neck region. Even she feels embarrassed to wear the necklace and jewels, whatever. And it is a social stigma also to have a goiter in the neck. You can appreciate here. This is a swelling which is above the neck. So it looks, this is a goiter. Even though the swelling is not very big, but it is definitely there and it is causing a problem to the patient. So now already we had given a local anesthesia in the same place we need to enter, so that no pain for the patient. Again, some amount of tumescent injection I will give, and then we will start the ablation procedure. See, in this ablation, we are using a thermal and electrical energy to specifically treat this whatever the thyroid nodule. So again, I am injecting the fluid. You can see that needle which is going under guidance without damaging any structures, any blood vessels, including the carotids. We can see there. So we are very, even though we are very close by, it's a micromillimeter precision. We are not damaging any nerves or any vessels, taking care of only this nodule. So that is the beauty of imaging. So this is image guided procedure completely under the image guidance. Can you take the nodule? Can you take the needle? So now we'll start microwave procedure. Yeah, take. This is a microwave needle. Yeah, take. So we are going to take it. This show the machine there. Yeah. So this is a microwave machine. It generates a potential between the 2 points, and then because of that potential difference, these microwaves are generated, destroying the abnormal cells where precisely we are placing the needle. That is a mechanism of microwave, so that the abnormal cells wherever we want, we can precisely destroy, such that the normal cells retains. So that is a mechanism of microwave ablation. So now we are going, it will have a needle. So which one we are inserting under the guidance of ultrasound, so that it destroys only the abnormal. So you can appreciate there the cyst area, everything. These are the abnormal areas which will get destroyed, and then the normal tissues like this. You can appreciate this. Here in the arrow mark, I am showing you. So this is a normal thyroid. This is a carotid vessels on the right side. Okay. In the left side, when I'm moving a probe, you can appreciate these are the abnormal tissues. So which is the target for us, and you can appreciate this is a fluid around the thyroid, such that no pain will be there, and heat sink, whatever heat damage will not occur to rest of the things. So we are going to start this now. Give him. Give that end to him. So this microwave probe will have a connector which is for the electricity, and some cold saline also will be circulated. And this is a tube. This is the needle of a microwave. You can appreciate that heat generation will be at the tip, 5 mm. So that will be distributed all around usually up to 1 centimeter around, so that the tissues will get destroyed. So that is the precision. Everything under the guidance. So this needle will go into the thyroid under ultrasound guidance. I'll show you how it appears. So when the microwave starts working, how it appears, I'll show you. Usually bubbles will appreciate. So this is the insertion of microwave needle. Usually we enter it through transsystemic route. Transsystemic means it is through the isthmus. Isthmus means it is the one of the pedicle where both the lobes are connected. So generally we go by transsystemic route. Amma know vidya? Okay. So we talk to the patient also, so that it's completely painless procedure. So you can show the screen also. See, that is a needle. You can turn the screen. Turn the screen towards you. Yeah. So hey, not too much. Okay. Now we can see that screen. That is a microwave needle. So I will enter in the posterior aspect first, because we start from the deepest portion and the lateral portion, and then starts moving. Then see. Ready?
Okay.
So ready? Okay. So how much energy you are setting? Okay. 30 watts, right? So now this is, I am starting the microwave ablation now. Can you see at the tip there is a bubbles entering into the cyst there. You can aspirate the cyst as well. You can appreciate that bubbles. Okay. Okay. Can you appreciate that? So we are doing with the moving shot technique. So now I am entering a little. Amma no idre elima.
ಸ್ವಲ್ಪ ಫೀಲ್ ಆಗ್ತಾ ಇದೆ.
ಫೀಲ್ ಆಗ್ತಾ ಇದೆಯಾ? ಆಯ್ತು, ಜಾಸ್ತಿ ನೋಡಿದ್ರೆ ಹೇಳಿ, ಇದು ಮಾಡ್ತೀನಿ. ಕ್ಯಾನ್ ಸಿ ದಟ್ ಐ ಆಮ್ ಮೂವಿಂಗ್ ಎವ್ರಿ beep such that that particular portion of tissue is, we want it to get ablated. You see that? Yeah. So now I'll go little up under the guidance. It is like a fan beam. We have to choose the areas. ಸ್ವಲ್ಪ ನೋಡ್ತಾನೆ ಸ್ವಲ್ಪ ಆಯ್ತು ಆಯ್ತು. So this is the deepest portion. Now I started here. This is a fresh area. You want ablation here. Now with the elima.
ಸ್ವಲ್ಪ ಲೈಟ್ ಆಗಿ
ಆಯ್ತು. So you can wipe here.
sound ಬರ್ತಾ ಇದೆ.
ಅದು ಸೌಂಡ್ ಬರುತ್ತೆ, ಅದೇನು ತೊಂದರೆ ಇಲ್ಲ. ಓಕೆ, can appreciate. This is called moving shot technique. As we ablate, the probe
Pain
keeps
ಆಗ್ತಾ
moving.
ಇದೆ.
Okay. ಚೂರ್ ನೋಡ್ತೀವಿ. Maybe little dull pain sometimes. Okay. You can see that appreciation of a bubbles. It's called moving shot technique. Every beep I am moving so that a new area is involved, new area is covered, so that the entire nodule is covered. This is called
Pain
microwave. Okay. ಆಯ್ತು, ಆಲ್ಮೋಸ್ಟ್ ಮುಗೀತಮ್ಮ. So now almost we have done. You see the entire nodule is covered and we are going to remove also. So can you show the tip?
ಮುಗೀತು.
Wait. Can you show the?
ಸರಿ ಸರಿ ಏನೋ ಉಳಿಸ್ಬಿಡಿ ಸರ್.
ಇಲ್ಲ ಇಲ್ಲ ಏನಿಲ್ಲ ಮಾತಾಡ್ತೀನಿ. So can you show the tip of the this one? This is the just the entry point wherein there is no. How much time it took? Almost. Yeah, in 3 minutes almost the entire nodule got ablation. So you can show this. There is no mark or entry scar or anything. That's the beauty of thyroid microwave ablation. Okay, thank you. So this is a non-surgical technique where there is no cut or incision. We can completely cure the thyroid or goitre, whatever acquired swelling. Especially it occurs in the women and young females because thyroid problems will come in a woman more commonly. So we can treat them. If it is a tumor, it's a different treatment. If it is a cancer, it's a different treatment. Non-cancerous nodules, which is swelling, can be cured without any surgery, without any cut, using this. Sometimes laser we can use. Microwave ablation is commonly used, and radio frequency ablation. Ablation means just destroying the only specifically the tumor, such that there is no need of thyroid hormone replacement lifelong, so that we are saving the rest of the normal thyroid from destroying or removal. Especially it occurs with a surgery where entire lobe or the entire thyroid is removed, and then lifelong replacement of hormone therapy is required, and their scar may remain. It's a major procedure. General anesthesia is involved. Here it is under local anesthesia. It's a daycare procedure. Patient will be comfortable. ಅಮ್ಮ ಹೇಗಿದ್ದೀರಾ ಈಗ? ನೋವಿದೆಯಾ?
ಇಲ್ಲ.
That is a beauty wherein patient can walk and go home. So it's a OPD procedure, but it has to be done under sterile conditions, comfortable way, and results are amazing. So next we have posted many times like how is pre and post, complete resolution and absolute 100% patient comfort and satisfaction. Thank you. This is a thyroid wave ablation commonly done regularly in our Adventa hospital. I am Dr. Bhaskar MV, interventional radiologist. Thank you for watching.